me get my glasses out just in case I need them. All right. Okay. Okay. Am I looking at you?
You can look at me.
Okay. Good. Okay. Well, welcome everyone, and I'm joined by my colleague, Minister of Health and Community Services, Minister Tom Osborne, as we can see him on the screen there. So, hello, Minister Osborne.
Good day. Pleasure to be here.
Thank you. A little over 2 weeks ago, we announced our government is beginning the process to replace St. Clair's Mercy Hospital. That announcement was a part of our plan to make significant accomplishments in healthcare infrastructure. It's about building modern facilities and reimagining the way we deliver services. We know that new modern healthcare infrastructure creates more efficient working environments, attracts and retains healthcare professionals, and leads to better healthcare services. I'm very pleased today to announce that a contract valued at $40 million has been awarded to Marco Group to improve and expand the emergency department at the Health Sciences Centre here in St. John's. The project will redevelop the 2,230 square meters of the current space of the emergency department and add a new 2,690 square meter extension. The new emergency department will include a psychiatric assessment unit, a high acuity trauma unit, a care initiation area, an ambulance parking garage, a medical imaging suite, an administration area, and a new entrance and registration space. And if our track record on other infrastructure projects is any indication, this new redevelopment and expansion will lead to high levels of employment for Newfoundlanders and Labradorians. And to give you a couple examples, we had 99% of provincial tradespeople, Newfoundland and Labrador tradespeople on the Mental Health and Addictions Hospital, and 92% provincial tradespeople on the West Coast Hospital, which we are very proud of those numbers. This redeveloped and expanded emergency department will serve patients at the Health Sciences Centre and the new Adult Mental Health and Addictions Hospital, which is currently under construction and is anticipated to be completed in 2024. It is also in addition to a parking garage with spaces for 1,000 vehicles, which open on the campus in November of 2021. And I had the privilege of visiting that garage, and to say it was impressive is an understatement. The new Adult Mental Health and Addictions Hospital and the modern expanded emergency department will help realign the delivery of healthcare services on the Northeast Avalon, increase access to healthcare, and ensure the appropriate infrastructure is in place to meet future healthcare needs. Once completed, these projects will lead to a modern campus of healthcare in St. John's. These projects, along with other projects such as the new West Coast Hospital in Corner Brook, new long-term care homes in Gander, Grand Falls, Windsor, and Corner Brook, new protective care unit in Botwood, and new mental health and addictions unit in Happy Valley Goose Bay will also help create more efficient and user-friendly environments for healthcare professionals, patients, and families. Work will begin soon on this emergency department redevelopment, and the anticipated completion date, it would be 2026. Great progress is being made on improving access to health care. Replacing St. Clair's, replacing the Waterford Hospital, expanding the emergency department at Health Sciences Centre are all steps in the right direction. And we're not done yet. Work is happening behind the scenes in this building, and we look forward to announcing more infrastructure projects in the coming months. Thank you very much. Now I'll open it up for questions.
I guess I have a question probably for Minister Osborne.
Sure.
I don't know if you can hear me there.
Yes, I can.
Okay. In the technical briefing, they explained that, when this redevelopment is finished, that if you have a mental health crisis or if you have a physical injury, you'll be going to the same emergency department. Can you just speak a little bit to the idea behind that?
Absolutely. So, this new emergency department will serve patients at both the Health Sciences Centre and the new Adult Mental Health and Addictions Hospital. It includes a psychiatric assessment unit, a high acuity trauma unit, a care initiation and an indoor parking, an unloading area for ambulances, diagnostic imaging, as well as administration. So, this brings together physical and mental health. This will connect both the new mental health and addictions facility as well as the emergency department for the health sciences complex itself.
Mr. Osborne, how many new staff are going to be needed to staff this new emergency department?
So staff in the existing emergency department will move into this. We are hoping that in addition to improving workflow, the delivery of patient care, that this new facility will need additional staff, but Eastern Health and government continue to recruit additional staff as well. It's not known at this particular time the number of additional staff. That's more operational. Eastern Health would probably have that.
Were there consultations done with this, and who did you speak to?
So, I guess both myself and Minister Lovelace can speak to this. Eastern Health were involved in this. This has been in the planning for some time. I know that, an RFP had gone out, and at that point, I guess I'll ask Minister Lovelace to speak to the process in terms of transportation and infrastructure.
Yeah, it closed the last of August, and a due process was required in evaluating the bids, and here we are today making the announcement. I'm not sure if I'm answering your question in terms of the jobs perspective as related to the healthcare staff that's required in this unit.
Were those, like, the healthcare workers or anyone that was consulted who's working in healthcare currently, were they receptive to this new design and these plans?
I think, and again, I guess both myself and Minister Lovelace can answer this to a certain degree. He and his department would be involved in design, but it's based on industry trends, best practices. It's designed to support effective, efficient, and lean workflows and the delivery of patient care. So, we had not only consulted with Eastern Health, we'd looked at industry best practices in how this should be designed. Minister Lovelace?
Yeah, and in terms of the consultation piece, if your question is this welcome by people that are in the medical field? Absolutely, and consultations did occur. And even my own conversations with medical professionals that will be involved in this on a daily basis, who's there now on a daily basis, is certainly welcoming this, and they certainly had their input into this, and certainly will have more input into it moving forward. So it's, I believe it's a good day again today for healthcare in Newfoundland and Labrador.
Can you speak to the location of the expansion? And I guess it will be on kind of what's a parking lot right now, and can you speak to like the parking spaces that'll be lost there?
Yeah, I can speak to that, and I don't have a blueprint in front of me to tell you exactly where it is, but it will be adjacent to the ER entrance now, and it will include parking spaces, and I believe 180 parking spaces will have to be used for this. But, proactive planning in terms of that garage that was built and opened in 2021 certainly will accommodate those 180 spaces that we're losing in the parking space that's there now. So I call that good planning.
Minister Osborne, what sort of disruption is it going to cause to the current ER, which is, for lack of a better word, overwhelmed right now? Because you're saying that you're going to get rid of the current entrance, everyone's going to have to go through the main entrance. What sort of disruption do you think that that's going to cause to emergency services at the province's largest hospital?
I know Eastern Health, we've worked with Eastern Health. They will work through this. The existing emergency department will continue to operate until the new emergency department is up and running. There will be some modifications, obviously, along the way, but Eastern Health will deal with this as we transition from the existing to the new.
Question is ER beds. Will the number stay the same, Minister Lovelace, or are we going to add more ER beds? What's going to happen there?
I think that's probably a question that Minister Osborne can answer on that in terms of ER beds.
So I'm not exactly sure. I'll get you that information from Eastern Health. I do know that in addition to a psychiatric assessment unit, which would include additional beds, the high acuity trauma unit, care and initiation, diagnostic imaging, and so on. So I anticipate, I don't know the exact number of new beds, but we can certainly get that for you. That would have been done in consultation with Eastern Health.
When this project was announced, was it in budget 2022? What was the cost less then? I thought, was it around $10 million when it was announced in 2022, or has the price changed?
Well, the amount that we're dealing with is 14 million, and that closed in August. So I don't have that initial number, but only to tell you that $40 million is the project cost that we're moving forward with.
When's the work expected to start?
Well, as soon as possible. It's the need. I think it's anybody who visits the ER entrance as a person who's been a patient myself, we know the need is there. So, in terms of planning process, this is not something that we're going to put the brake on right now. So we will be proceeding forward with the necessary steps, and in seeing this well-deserved project and needed project happens in this province sooner rather than later.
Many people who visit the emergency room today aren't very happy with the service. There's long wait times. There's a lot of talk about the wait times. How do you then try to have to justify this? Now there could be further delays because of this expansion. There's construction, so it could make it harder. So I guess, what do you want to say to the people of the province to have patience, or what would you like to say to the people of the province who are already currently upset with the government about the long wait times at Health Science Centre?
Well, again, I don't think people of the province is going to be disappointed that we're doing this today, because it's really all the envelope of the healthcare in this province, that infrastructure that's badly needed. In terms of the mechanics of it, I'm sure the professionals will work this out. But anytime that there is construction to an existing building, there will be inconveniences, no doubt. But I think we need to keep our eye on the main objective here, and that is improving a healthcare facility that's badly needed, and that will therefore improve the healthcare services for the people of the province.
What is next on your, you just announced the St. Clair's replacement. What are your eyes on next in terms of infrastructure replacement?
Can't tell you that. Just all I can say is stay tuned. There's lots of planning, there's lots of discussion, and we have an agenda, and it's. I think now is the time that we continue to invest in the province, whether that's healthcare or other related areas. But we know healthcare infrastructure is important, and today we're announcing another piece of that.
I just wanted to ask again, because I just found it. It did say in this budget $10 million for the redesign and expansion of the emergency room at the Health Sciences Centre. So I guess why are we seeing such a big cost increase there?
Well, there is the design phase, and then there's, the overall project cost. So, but I don't have the answer in terms of, we went from 10 to 40 at this time, but we can certainly get you the details on that. But,
I would also be interested in details on that. Is it a matter of just like that's what you budgeted for this year for the project, and you'll be budgeting more in the future? Is that how you do things with that, or was there literally just a cost increase from what you guys expected?
I'm not sure if Minister Osborne, if you want to delve into that one.
Well, I think we all know that the costs of everything from building materials to labor have increased. We see a cost increase on everything. Inflation has had an impact. So there was some money budgeted in the current budget. There will be funds accounted for in the upcoming budget. But I think this is something that is to be expected, that the costs, the projections on a project, what we anticipated the cost would be 2 years ago or even 18 months ago, those costs have gone up on all projects. That is something that unfortunately is to be expected, whether it's a home renovation or the construction of a new ER center. I will say again, and just, I know there was a question earlier, about the inconvenience to patients. I think not only from our healthcare professionals, but from patients themselves, we need an improved workflow and an improved working environment within the emergency department at the Health Sciences Complex. So first and foremost, as part of this project, is not just tying the mental health and addictions facility to the physical health facility and creating additional units within this facility, indoor unloading area for ambulances, which is a huge benefit and a huge positive. This is much needed to improve workflow for our healthcare professionals, which is something that is badly needed in that area now. It will also improve the flow for patients. So, this is, while there may be some inconvenience in the process of building this, the improved patient flow and the improved workflow in the area is something that is absolutely needed. The Health Sciences was built back in the 70s. The best practices today dictate that we need to make improvements.
Mr. Osborne, sorry, go ahead.
I just want to go back to, because you kind of like switched the answer to the question, because we were talking about the price increases at the beginning there. So just to clarify, this isn't just a matter of, there was this amount budgeted this year. That 10 million was supposed to be for the whole project, and it has gone 3 times that. Am I understanding that correctly? Like, is that how this is happening, or was it? I just want to make sure I'm clear on the price increase here, if it's actually that much of an increase, because that's a huge increase.
Well, we know there's an increase in the project cost, and it's and if I can just try to add a little bit of perspective to it, it's no difference in the road work. This year, our roads plan saw an increase in cost to projects. We could have decided to say, no, we won't proceed any further because we got higher costs. We did not, and I guess in terms of the worldly pressures around labor costs, material costs, and everything else, it has risen, and this project is no different. But it doesn't we don't put the brake on it and say we won't do it because of that, because it's certainly badly needed. And we've made that decision as a government that the infrastructure is important, is crucial. So we're moving on. We're moving forward with the project.
Where's the extra 30 million going to come from?
Well, the budgetary process. You look at all departments, I guess, in terms of the need, and we certainly know the need is there in healthcare, and so as a government, we're proceeding with that. And and I'll leave it, I guess, to the Minister of Finance when she does her budget this coming spring in terms of where the money is going to come from. But we have to invest in the people of the province, and Healthcare is certainly paramount, but in reality, it does cost.
One more question on this, and I'll stop on this, but are you taking into account, like, so when you announce the, like, you know, when you're looking at your other projects that you've kind of, like, announced, are you taking into consideration these cost increases when you're looking at things like the St. Clair, when you're working at your budget for the St. Clair's replacement, being, like, obviously so much higher?
Well, I mean, you have to. It's because what's going on in the world kind of moves that pendulum for us to have to discuss the extra cost. And we know in terms of construction, whether that's road building or building at the St. Clair's Hospital, we know that challenge lies there. But what also lies is the challenge of providing good health care to the people of this province. And that is part of our plan. We're going to continue to invest in that.
Minister Osborne, Minister Osborne, a lot of people concerned about the potential for a wave of RSV and influenza in the pediatric population because they're looking to Ontario, Quebec, and other jurisdictions and seeing that pediatric hospitals are overwhelmed. I'm wondering, you know, with the potential for that to come to Newfoundland, is there any discussions happening with Eastern Health in terms of, I don't know, contingency plans to have more available beds in case the hospital is overwhelmed?
So that's an excellent question. The Premier had called a meeting of the science table, which I attended on Monday of this week. You know, that includes folks from public health, Dr. Rahman and others. We, based on the advice provided by public health and Dr. Rahman, we are looking at you know, what we are currently seeing and what we expect. No doubt there will be impacts as we see in other provinces, but they're not, at this stage, we're not seeing those impacts in this province. The possibility is always there. We always work with our health authorities in consultation with public health, Dr. Rahman and the science table as we move forward. But right now, we're not seeing the numbers in this province. You know, while there is a possibility that we will see that wave here as well, we're not seeing it at present.
Minister Lovelace, further to the conversation earlier about project cost overruns, we're hearing that the cost of the new mental health and addictions facility has ballooned due to inflation. Just wondering if you could speak to that and how much it has gone over budget thus far. Yeah,
I don't have the number that you're referencing right now, but and I guess it goes back to the I guess the challenge of proceeding with these necessary projects, and that's another necessary project. And the reality of it is, not just us as Newfoundland and Labrador, every jurisdiction is dealing with the increase in cost because of things that are beyond our control. And you know, the mental health facility is another piece of our health plan that is crucial and important, and we plan to move forward with that project.
Another question for Minister Osborne, real quick. Across Canada, there is a shortage of doctors. How confident are you that you'll be able to fill some of these positions needed to run this expanded ER that you're announcing here today?
You know, despite the fact that there is a shortage of healthcare professionals across Canada, throughout North America, and in fact globally, we are taking measures. We brought in the Medical Act, for example, which allows us to identify areas globally where the licensure would be similar to licensure here. Having said that, we are working with the College of Physicians and Surgeons. We're working with the colleges of nursing as well, both the Registered Nurses College and the practical nurses. We, working in consultation with the colleges, we've been making improvements to licensure. We've been adding additional classes of licensure. For example, with the College of Physicians and Surgeons, we are doing dedicated recruitment, as we know, with the nurses, nursing recruitment in Bangalore, India. We are also going to have very targeted physician recruitment The mission in Bangalore is in consultation with the college. The college will be attending. Similarly, when we do position recruitment, we are planning those direct recruitment drives now, and the College of Physicians and Surgeons will be partnering with us and attending those recruitment drives. So we are doing everything possible to recruit healthcare professionals in a very competitive global market. I'm confident that we will see success from those recruitment drives, from initiatives such as the Medical Act and the incentives and other initiatives that we've put in place.
Good. Thank you, everyone. Enjoy the rest of your day.
Thank you.
Thank you.
Thank you.
Thank you.